for most of my body cases, we'll use a foam garment as the first part of the compression system. So here you see the foam garment is in place. You can see this pointed end is pointing up between the breast. And it's really important that this lower part of the foam kind of resides just at or pretty much on top of the pubis. So you don't want this riding up where it's pushing, swelling down. You want to err on having it lower, if anything. So this is the foam garment that's put on first. And sometimes people put a t-shirt on underneath or something that keeps it comfortable, but it's the first compression garment people wear. And if a model here will turn around just a little bit, you'll see that the foam velcros in the back across here. It doesn't need to be super tight, it just needs to be held firmly in place, because the next step is going to be a compression garment on top of this. You can turn back. So again, first level is the foam garment here. Typically people are wearing this for 2 weeks. Now I'm going to show you what it looks like when the garment that goes on top of the foam, how that looks like. Okay, after the foam garment is placed, then we put the compression garment on top of the foam. Now you can see here there's multiple clasps, so you can start at the tightest, but over time you can make it tighter, even looser as necessary. So on the bottom half here, just as an example, we have it on the tightest setting, and up here on the top you can see these extra rungs, we've put it on the looser setting, and you can see the foam is underneath of this. The other important thing is this clasp on the bottom, which comes on the, basically covering up the groin. This can be unsnapped to go to the bathroom, but it's very, very important to keep it snapped at all times. Now, this garment will typically be resized at 2 weeks. So frequently we'll remove the foam from underneath at 2 weeks, and patients will go to a smaller one of these garments at 2 weeks.